Welcome back. In the chapter of preventive medicine and obstetrics, pediatrics, and geriatrics, in today's session, we are going to discuss about the growth chart. The growth chart is used for monitoring the growth and development of a child. So, we know that the growth chart obviously will be used for monitoring the growth as well as the development of a child. Who designed this growth chart? It was designed by David Morley and later it was modified by the World Health Organization. So we see that you can have a look at this picture of this growth chart. This growth chart is used for monitoring the growth as well as the development of the child. It was designed by who designed the growth chart? David Morley designed it. Later, the World Health Organization modified it. And the growth chart is also known as the Road to Health chart. Moving on, we see that the weight, it is a weight for age chart. Now we see that in the x and y axis, we consider the weight and age. The weight to age. So you can see in the first year 12 lines are there, 1 month each line. Okay, here also 12 lines. This is second year, this is first year, second year, 3 years. So this is the age and this is the weight. We are recording the weight. So we see that it is a weight to age chart and we don't consider the height to age. We are not taking the height. Also, let's see why we are not taking the height and why we are considering the weight here. Height of the child is not taken because when the baby becomes an undernutrition kid, it will start losing its weight but not the height. We can see that if the baby, which was 10 kgs, if it starts becoming undernutrition, then the baby for its age might become 5 kgs or 7 kgs. So we see that the baby is losing weight when it becomes undernutrition. And if the baby was 130 centimeters or let's consider 100 centimeters, then it won't become 80 or 70 centimeters once it start becoming undernutrition. The height will remain 100 centimeters only. It might not increase, but it won't start decreasing. The baby's height won't differ, but once the baby becomes undernutrition, it will start losing the weight. The baby loses the weight but not the height. So when the examiner asks you what is the reason, why is the growth chart considered as a weight to age chart and not height, you can say when the baby becomes undernutrition, it will start losing its weight. Next, we see 49 types of growth charts are used in India and it is used under the NRHM and ICDS. So we know that the growth chart is used under the National Rural Health Mission and the Integrated Child Development Services. So we see that National Rural Health Mission. It is under the National Rural Health Mission and ICDS, that is Integrated Child Development Services. So the growth chart is within the NRHM and ICDS. So let us see the MCP card and the other two types, that is ICDS growth chart and World Health Organization growth chart. Beginning with mother and child protection card. So we see that the MCP card, a joint mother and child protection card, has been developed where we record the information both about the mother and the child. Mother and child protection card. So we consider the date, what are the information which is provided. Also this MCP card is also present for both boys and girls differently. For the boys it's blue color and for the girls it's available in pink color. So we know that girls pink and boys blue. So the MCP card has two separate growth charts which is present for both boys and girls. Now let us see what is the information which is available or provided in this growth chart. So we know that it is a joint MCP, mother and child. So With regards to the mother, you can see the ANC services, antenatal care, what has been provided to the mother will be recorded. And with regards to the child, we see the birth date. In the first point, we have the birth date. You can see the birth date or the age, followed by birth date in the first point. Second, we record the baby's weight and the weight for age. We know that it is a weight for age chart where we are recording the weight of the baby in each month or in each year, what it is. So we see that we are recording the weight for that age, and the developmental milestones of the baby are recorded. We know that in the previous video we studied the various developmental milestones. In 4 to 6 months, the baby will turn over, and the crawling, creeping, cruising, standing without support. It stands without support in first year. We saw various milestones what the baby will come across in his growth. So all of that has to be recorded, and the immunization status and the immunization procedures will also be recorded in this growth chart. The various immunization procedures and the what is the current immunization status of the baby, how many immunization schedules have been followed, and what are the remaining ones. All of that information will be provided. And the introduction to the supplementary food. So we know that 6 months exclusively breastfeeding has to be done, followed by there is introduction of the protein rich food in the baby's diet. So that is the supplementary food. When protein rich food is added into the baby's diet, then it's the supplementary food which is added, and that is how the weaning period starts. So that when was the introduction to the supplementary food done has to be recorded, and the ANC services which the mother receives have been recorded, and the history of the siblings health. If this baby or the girl, she's having a brother or a sister, their health status should also be recorded, followed by the child spacing contraceptive methods used. So the various contraceptive methods which is used by the women or the mother to space the children, that is one child and the other child, to space the kid, what type of contraceptive method, which we have studied the various contraceptive method in our previous videos, which is available in the playlist. So we see that hormonal method, or she used a copper T, any of those contraceptive method what she used has to be recorded. So let us see the information provided. Mother and child protection card, MCP card. So with regards to the mother, the ANC services and the child spacing contraceptives used, 2 points. Next, the child, we see that the birth date, the weight of the baby and weight for age, followed by once the baby is born, then the developmental milestones, then the immunization will be done, followed by the introduction of the supplementary foods is done, and then we have the history of the siblings health should be recorded. Date 2, 3, 4, 5, and we have 6 points for the baby and 2 points for the mother. So this is how you can segregate and remember. This is about the MCP card, that is a mother and child protection card. Clear guys? All the points are clear? Moving on, we have two types of growth chart. We have ICDS growth chart and the World Health Organization growth chart. So the ICDS growth chart, it is separate again for both sexes, like the MCP card, mother and child protection card. Similarly, in the ICDS growth chart, it is pink for the girls and blue for the boys. So the MCP growth chart had different sections. Similarly, ICDS is also separate for both the sexes. It is based on the World Health Organization MGRS child growth standards. So this ICDS growth chart is also under the World Health Organization standards, and it is used for the growth monitoring, especially at the Anganwadi centers. We see that it has been used in the Anganwadi centers, ICDS growth chart. And very importantly, the ICDS growth chart will have 3 reference curves. So you can see here the three reference curves it contains. The first one is the reference standard. So you can see this green color. Okay, the beginning of the green color, it is reference standard. Okay, green. So reference standard. Then 2 SD below the reference standard. So go 2 SD below. Go 2 SD below the reference standard. We have this yellow color line, yellow color. So we have minus 2 SD, that is go 2 points below the reference standard, and then 3 SD is below the reference standard. Then we go further down, that is minus 3 SD below the reference standard is minus 3 SD below the reference standard is the other reference value which is given. So we have three things. Let us do it again. Red, we have minus 3 SD, and then we have yellow, that is minus 2 SD, and we have green color which is the reference standard. The growth chart will show the normal zone. This green color what we see here is the normal zone, and it is green color. If the baby, when you record the weight of the baby, now let us understand it. So we see that if the baby's weight for 2 months is 5, and for 6 months or 8 months it is 8, and then followed by the 2 years the baby's weight is 10, and by 3 years the baby's weight is 13 or 14. So we see that when the baby's points are placed like this and the growth curve is going like this, it is falling under the green zone and it is safe. And when you record, if the baby's weight is falling here under the yellow color thing, then it shows that the baby is under nutrition, that is between minus 2 SD to minus 3 SD. And the last dangerous part is that when the baby's weight, when you record the baby's weight for the 1 year, the baby's weight is 4.55 kgs, and for the end of 2 years it is just 8 kgs, and by the end of 3 years if it is just 8.2 kgs, so we see that, or it is 8 kgs only. So when the value, when the curve is following under the red zone, it shows that the baby is severely undernourished, and the undernutrition can be seen, and it will be minus 3 SD of the reference value. It will be minus 3 SD of the reference standard. And if it is following under the yellow curve, it will be minus 2 SD, and if it is green, it is the normal zone. The baby is safe and it is not going towards the undernutrition. Yellow, it has started going towards the undernutrition, and red, it is completely severely undernourished. Okay. Yellow, it shows that the baby is undernutrition. The baby is undernutrition here, severely undernourished. Clear, guys? Green, the baby is safe. And if it is yellow, the baby is undernourished. If it is red, the baby is severely undernourished. Okay, so we are done with this. Similar is for the boys as well. Next, we see that the objective of this chart is that we should keep the child in the normal zone. So by measuring this the growth and the development, we can interpret if the baby is going towards the undernutrition, so that we can take measures and improve the child's health. The flattening of the curve. So when the flattening of the curve occurs, if the flattening occurs, if it started going, so let's see this. Okay, if the baby's growth started like this, and then the flattening occurs, then the baby's growth, if the flattening occurs, it shows that the baby is going towards the undernutrition. So it's a danger sign. We know that it signals the growth failure. It is the earliest sign for the protein energy malnutrition in the children. If there is flattening of the curve, it is a sign of PEM, that is protein energy malnutrition, and it shows the growth failure. Clear, guys? ICDS growth chart. We have two separate growth charts for the boys as well as the girls. Boys and girls, two separate growth charts. It is used at the Anganwadi centers, and three reference curves. What are the reference curves we saw? The reference standard, -2 SD, -3 SD. If it is green, it is safe. If it is yellow, it is undernutrition. If it is red, it is severely undernourished. What is the objective? The objective is that we have to keep the baby in the normal zone. And if the flattening of the curve occurs, it shows that there is growth failure and the baby is heading towards a protein energy malnutrition. Next, we move on the World Health Organization growth chart. The World Health Organization growth chart is same for both the sexes. So far, we saw that mother and child protection card was different for both sexes. ICDS growth chart was also different for both the sexes. But the World Health Organization chart, it is same for both the girls as well as the boys. The same chart has been used. Again, the information, what you can see, the name of the child, the birth weight, all of that will be recorded. And now the reference curves, very important, the reference curve. We have the upper reference curve, UCR, upper reference curve, which is 50th percentile for the boys. And the lower reference curve, the third percentile, is used for the girls. If it is -2 SD, it is below the median weight for the age. Now here, what is the difference? So we see that the upper reference card is 50th percentile and it is for the boys, and the lower reference curve is third percentile and it's for the girls. And when it is found below this, it is -2 SD. And the thing which is missing is -3 SD is not found in this card. Also, it's same for the both boys and girls. Okay guys, we see that -2 SD below the median weight for age. If it is below this, it is -2 SD. And it is also known as the road to health chart. We know growth chart is also known as road to health chart, or zone of normality is the space between the two curves. So we see that the space between the two curves, you can see the two curves here, and the space which is present in between these two curves, which is the road to health, is the normal zone. Zone of normality is the space between the two curves. It is based on the National Center for Health Statistics, NCHS standards. So we see that National Center for Health Statistics standards, the USA standards. So this was about the World Health Organization, which is based on the NCHS standards. So again guys, let us revise this World Health Organization growth chart. World Health Organization growth chart is same for both boys and girls. It has two reference curves, the upper reference curve which is 50th percentile for the boys, and the lower percentile, that is third percentile, for the girls. And the difference between these two curves falls the normal growth occurs when there is the space between the two curves shows the normal growth. And the below this curve is the 2 SD. 2 SD is below the median weight for the age. Below this curve is the -2 SD, and we don't have -3 SD in this card, and it is based on the NCHS standards of USA. So this was about the World Health Organization growth chart. Now moving on to the uses of the growth chart. Very important question. What are the uses of the growth chart? So we know that for growth monitoring, which is of a great value in the child health care. So by monitoring the growth, we can easily identify if the baby is going towards the high risk, and we can do the needful. And next we see the diagnostic tool for identifying the high risk children. So it's used as a diagnostic tool so that you can identify those high risk children. For example, you see that malnutrition, you can detect it long before the signs and symptoms will develop in the baby. Even before the signs and symptoms will become apparent, you can diagnose it long before, and that diagnosis will help us to take care of this high risk children and prevent them from entering into the PEM. Next, the education tool. So we see that because of this the visual character where everything is recorded, so simple, that age and that weight, you can just you can show it so easily to the mother. You can show her, see, when the baby was 3 months the weight was so much, and now the baby's weight is falling down, it's coming here. So we see that the baby's weight which was going up, and now it is falling down. So this way you can show that the your baby's health is deteriorating. So the baby is undernourished, it is malnutrition now, so she has to work on it, provide a proper nutrition to the baby. So this is how you can educate the mother regarding the health of the baby. Because of its visual character, the mother can be educated so that she can take care of her child. And also, we have to encourage the mother to participate in the growth monitoring. That is the education tool. It will help to teach the mother the benefits of the adequate feeding. Also, you have to tell that if the mother is doing the exclusive breastfeeding, and if the baby has started to lose weight, you have to teach her that now the breastfeeding is not adequate to the baby. You have to make sure you feed the baby well. And next, if the baby is more than 6 months, then you should ask the mother to include the protein rich supplements in the baby's diet. So this is how you can rectify and educate the mother regarding the growth of the baby. And tool for action. So we know that it will help the health workers on the type of intervention which is needed. So that will give us a idea. The growth chart will give us an idea about the type of intervention which is needed, what type of treatment, what type of measures to be taken can be made out by having a look at the growth chart. Next, evaluation. So the growth chart will provide us a good method to evaluate the effectiveness of the measures. So we can understand to which extent the program has been effective, and what was the impact of a program on the child and of the child's growth and development. So for example, if there is a program which is brought by the government, and by checking at the growth charts of the children in that area who are taking that government service, you can understand how well the program was implemented, and what was the effectiveness and impact of that government service or the program on the children. How can we assess it? It is by having a look at the growth charts of the children. If the children were under the red zone, and now most of the children in that area were falling under the red zone, after the introduction of this government service or the program, which were providing good nutrition to the mother and the child, and such immunization and all of that, if they have included, and now you are looking at the growth charts, all the children, there is a shift from the red zone to the green zone. So it shows that the program was effective, and it is got a positive impact on the child's growth and development. The last is the planning and policy making. So we know that by grading the malnutrition of the babies, it will give us an objective basis for planning our policies in relation to the child's care at the local level or the central level. It will give us an idea, it will give us an objective, so that we can plan the policies according to the needs of the children at that area, in that area. So this was about the uses. What were the uses, guys? Growth monitoring, obviously growth chart for growth monitoring. Growth chart is obviously for the growth monitoring. And diagnostic tool, education tool, tool for action, evaluation, planning and policy making. So we see that diagnosing and intervention. You can see diagnosis and treatment. Diagnosing, doing the required intervention, so the tool for action. Then Evaluation and policy making, you can remember together. You evaluated the effectiveness of your program and modified the planning and policy in the next step. And a educational tool for monitoring the growth. So you can remember in the set of 2 so the growth monitoring and educating the mother regarding the growth of the baby. Next, diagnosing any malnourished kid and doing the intervention, the treatment, required treatment. This is done, this is done. Lastly, you evaluated your program and brought in the planning and the policy changes in the next program. So this was the uses. Moving on to the references or the standard values of growth. We know that there are certain standard values of growth, that is the Harvard or Boston standards, NCHS standards, World Health Organization reference values, and Indian standards, ICMR values, and MGRS values, that is World Health Organization 2006 values. So we see that the multicentric growth reference study was done in 1997 to 2003, and the cohort study was on 8,440 healthy breastfed infants and the children of 0 to 60 months, that is 0 to 5 years. And the 6 countries, that is Brazil, India, Ghana, States, United States of USA, Oman, and Norway. In these areas, the studies were done. In these countries, the studies were carried out. So this were the standards. So we see that the standards which were generated, they were using this standard values for growth. What are the 3 main standard values? They are Harvard and Boston values, NCHS standards, where the World Health Organization values are reference values are used, and Indian standards are under the ICMR values. And lastly, we have MGRS, multicentric growth reference study, which was based on the growth reference studies, cohort studies, which was carried out in these countries. How do we remember? BIGSON, that is Brazil, India, Ghana, United States of America, Oman, and Norway. So these areas where the MGRH was like values are used. Okay, thank you. With this, we come to an end of the growth chart. Let us see the MCQs which were found in the previous question papers. Let us see which are those. The growth chart, very important. It is used for monitoring the growth and development of the child. Who designed this growth chart? David Morley designed this growth chart. Next, we have another MCQ, that the growth chart also contains the immunization status and immunization procedures in the children. This was an MCQ found. And it also contains the history of the siblings' health. Usually in the MCQ, we don't think about the growth chart containing the history of the siblings' health. Don't forget, it also contains the history of the siblings' health, and the contraceptive method used by the mother for spacing the children is also mentioned. These are the 3 MCQs which were found. The growth chart contains immunization status, history of siblings' health, child spacing. So A and C also don't forget, guys. Okay, the other things which we have studied earlier. Next, we have ICDS growth chart. It is based on the World Health Organization's MGRS growth standards, and it is used for growth monitoring, especially at the Anganwadi centers. So which card is used in the Anganwadi centers? It is the ICDS growth chart. Next, World Health Organization growth chart, 50th percentile. The upper reference value curve is of the 50th percentile for the boys. Lower reference curve is the 3rd percentile, it's for the girls. And it is a road to health chart. Growth chart is also known as road to health chart, or the zone of normality. What is the zone of normality? The space between the 2 curves. The space which is found between the 2 curves is the zone of normality. Okay. So this was the World Health Organization. And the uses, we don't have any MCQ. And lastly, we took a review of the growth references. What were the standard growth references used? So we had this multi-center growth reference study. So we know that multi-center growth reference study, there's an MCQ. So the multi-center growth reference study, which was undertaken in 1997 and 2003, this growth study was undertaken in which countries? BIGSON, Brazil, India, Ghana, United States of America, and Oman and Norway. So this MGRS, that is multi-center growth reference study, which was taken in 1997 and 2003 in Brazil, Ghana, India, Norway, Oman and USA, and the growth data was gathered here. Okay, and how did we gather this growth data? It was a cohort study. This multi-centric growth reference study, it was a cohort study which was done on 8,440 the breastfed infants and the children from 0 to 5 years. So the study was done, cohort study was done on these children, and the growth reference study was made. The values were considered, reference standard values were considered. Next we had Indian standards, there is no MCQ on it, and NCHS standard was also there was an MCQ. So the reference standards which were used, so the World Health Organization concluded the NCHS growth reference for the international use. So when they ask NCHS standard, the World Health Organization reference value is the NCHS standard. They considered as an international value, standard value is the NCHS standards. Then we have Harvard or Boston standards, and we have no MCQ on it. So these were the reference standards. So, you're clear guys with this reference standards? Harvard standard, NCHS standard. Regarding the NCHS growth references, you know that it was undertaken by the World Health Organization, and it is recommended for the international use. Throughout internationally, we consider the NCHS standard. Then the Indian standards. Indian standards is ICMR values are considered. MGRS, World Health Organization 2006 values. Under this, what did we study? That it is a multicentric growth reference study which was carried out in 1997 to 2003, and it was a cohort study which was done on 8,440 healthy breastfed infants and children of 0 to 5 years, and it was carried out in 6 countries. Okay, and they gathered the information, and they set the standards. So this was the reference standards. Thank you. With this we come to an end of the growth chart. I hope everything is clear. If you like my video, hit the like button and subscribe.